Dr. Sutter Caton here, physical therapist. Today I'm going to talk to you a little bit about ACL injuries. So the ACL stands for anterior collateral ligament, and that's a ligament in the knee that's mostly responsible for preventing excessive rotation and forward translation of the lower leg on the upper leg. Now, when we talk about the injury, we typically grade them 1, 2, or 3 based on the severity of the injury. So a grade 1 just means that the ligament was stretched, but it wasn't torn. So usually there's no instability, there's minimal pain and swelling, and typically you're going to recover within a week or 2. Grade 2, there's a few fibers torn, but not fully. There's going to be a little bit more pain and a little bit more swelling. The patient may even report a little bit of instability in the knee, and this may be looking at a month or 2, or possibly even more based on how torn it is. A grade 3, on the other hand, is a fully torn ligament. So this is the case where you're hearing about athletes that are out for 6 months or more. In that case, it can be a little bit of variable as far as the symptoms. There may be a lot of swelling, there may be minimal swelling. The main thing you're looking for is the patient's going to report that it feels like the knee's buckling or it feels like the knee's very unstable. So let's look into how this injury often occurs. So in the majority of cases, it's what we call a non-contact injury, meaning the player is just either changing direction, pivoting, decelerating, or otherwise not coming into contact with another player. So how this happens, if you can imagine I'm driving off of my right foot to go to my left, when I push, my knee can fall into this what we call valgus position, and my upper thigh can sort of rotate out and my foot stays planted, and this basically directly stretches those ligaments and with enough force can damage them. In the other 1/3 of cases, it can be a contact injury, meaning the player or object comes into contact with my knee, causing the injury. So a similar mechanism, you can imagine if I'm running, say with a football, and a player comes and tackles me and hits me on the side of my knee, he can easily push it into that same position. So there's a few risk factors that can predispose somebody to developing an ACL injury. The main one, unfortunately, is that women are 3 times more likely to experience an ACL injury compared to men. It's a combination of factors. A big one is that they have what we call a greater Q angle. And so the Q angle is just a measurement of the angle from your pelvis to your knee. So women have wider pelvises, and that basically puts their knee in a sort of a valgus or a caved in direction already, which can make it a little more susceptible to injury. The other one is that they have greater ligament laxity, so their ligaments don't have quite the same integrity or stiffness compared to men. When we look at causes in both genders, hamstring strength is a big one, especially in relation to quadricep strength. So people that are what we call quad dominant or have well-developed quads but are weak in their hamstrings, it can lead them susceptible to this kind of injury. Diagnosis of this injury is fairly straightforward. As a physical therapist, the first thing I'm going to do is take a nice subjective history to get an idea of what the patient was experiencing when this injury occurred. Next, I'm going to perform physical special tests to determine if there's any laxity present in the joint or if there's still integrity of that ligament. Finally, the gold standard is going to be an MRI to confirm if there's an injury and also the severity of the injury. Next, I want to talk about treatment, particularly in the cases of a grade 3 or a fully torn ACL ligament. So depending on the patient's age, fitness, and prior level of function, it's going to determine whether they are eligible or whether they even want to have a ACL reconstruction performed. So if, say, we're talking about an 8-year-old lady who tore her ACL taking the wrong kind of step down a curb, and her highest level activity is going to the grocery store, it doesn't really make sense for her to undergo an intense surgery to repair that ligament when, with proper rehab and conservative treatment, she's going to return to the same level she was at. Now, if we're talking about, say, a 22-year-old football player, or even just your average person who still wants to participate in athletics and is young in age, they're going to be eligible for this surgery. And although the rehab is long, you're looking at 6 months, maybe even more, the results are fairly good and you'll be able to return to your prior level of function. As far as how the reconstruction is performed, typically they're going to use either a portion of your patellar tendon, so below the kneecap, or a portion of your hamstring tendon to replace the ligament. Now, each of those come with their own issues. Basically, if they take the hamstring, You might have weak hamstrings, you might have hamstring tendonitis issues, but you're going to have similar issues if they take the patella tendon. There's also an allograft, or taking a cadaver ligament and replacing it, but that's kind of fallen out of favor as they're finding the results aren't quite so good with that, and it is a little bit longer of a recovery, and it doesn't have quite the same strength as taking tissue from your own body. Well, I hope you learned a lot today. Remember, if you're having pain or symptoms persist, remember to see your own physician or physical therapist in person for a more thorough evaluation.